Dr. Gary Bowden. I'm here in northern Pittsburgh. I acquired the Piezo Wave 2 after a strong recommendation from Travis and of course doing my own research. And once I looked into the research of what the clearances were and what kind of treatments I could go ahead and perform, it seemed like a great time to go ahead and have Travis come in and utilize it on numerous patients with different conditions and see how they responded. With the Piezo Wave, it has completely changed my practice because now it is a great, phenomenal diagnostic tool. So right off the bat, I can put it on as an exam piece of equipment and put it on a lower back and find out what muscles are actually problematic, where the trigger points are, where the muscle weaknesses are, and how they actually are correlated with my functional testing. And then after going through treatments, typically within 1 to 2, people are already seeing a result right off the bat that quickly. They don't have to wait to see how long a treatment is going to be effective for them, because they're going to go ahead and see the changes right then and there. Matter of fact, we use this on people from sports, baseball, basketball, football players, track stars, to people that have severe levels of compression fractures, stenosis, with really good results. Matter of fact, I have the ultimate guy right here, 3-star General William G. Pagonis, who can tell you exactly his experience with utilizing the Piezo Wave also.
Well, first of all, I've been dealing with chiropractic support since I was 23. When I joined the Army, the first thing they told me, my feet were too flat and they should have never signed me up. So I've been wearing orthotics and all that. The key here with this practice is that we identify the disease in addition to the symptom. The symptom is found, and then with these two machines, you're able to zero in and provide the proper penetration of heat that allows you to fix whatever the issues are. However, the difference in his practice than most chiropractors, is that he first goes through and diagnostically decides what is the issue, what has to be corrected. Then he explains it to the patient in layman terms. Then he applies these machines which allow him to really concentrate the efforts to correct the issue. And I've seen some patients here that could hardly walk out the door after a treatment. It's just amazing what the heat and the penetration and the wave system is doing to advance chiropractic to the next level.
So now, after having this for close to, well, actually over a year now, I wouldn't practice without it, just because it's just another tool in the bag. Not just another tool, but the number one actually from when it comes to a diagnostic protocol that you can go ahead and utilize right there in your own office. You don't have to refer out anything. You can actually do the exam, see where the underlying myofascial adhesions are, scar tissue, and then of course the second phase is getting into letting those stem cells come in, letting the angiogenesis occur, and letting healing occur by typically 50% right then and there while the treatment's going on. And then of course the next 2 days the person's going to go ahead and start the healing process themselves. But they feel the healing right then and there, which is great. And as a practitioner, the most exciting part is it takes out the guesswork. So if you don't want to guess about like what's wrong with the person and actually solve people's problems that have been gone from chiropractor to chiropractor or physical therapist to a physical therapist, the Piezo Wave by far is the piece of equipment to go ahead and use.